My name is Dr. Stephen Bradfute. I'm an assistant professor in the Center for Global Health in the Department of Internal Medicine, University of New Mexico Health Sciences Center. I'm a viral immunologist. My lab focuses on immune response to emerging viral infections and also vaccine development and therapeutic options for a wide range of viruses. I work on hantaviruses, Ebola viruses, Zika virus, and the last several months my lab has been working on SARS-CoV-2, which is the novel coronavirus that causes COVID-19. A lot of the work that we do is testing either new drugs or drugs that are already around for different things. We test them against their ability to stop the coronavirus from growing in cells that are in kind of like a petri dish experiment. So it's an early stage experiment. Do these drugs work against coronavirus? So we've done that with multiple groups, and we found several that do appear to inhibit the ability of these cells to grow, of this virus to grow in cells. And so that's the first step. And the second part of what we do is basically testing different ways to inactivate the virus. So of course, one of the concerns is if you're wearing a personal protective equipment like a mask, how long, if you're a healthcare worker and you get virus on your mask, how long does that virus live on your mask? What are different ways to inactivate it? Can you heat the mask? Can you shine UV light on the mask? Can you use a disinfectant on a surface when the virus falls on it to kill that virus? So we have tested multiple different inactivation methods for the virus, either on personal protective equipment or on surfaces, and we found some that work and some that don't. Some of these are starting to be published in scientific journals, and tends to take a little bit longer because it goes through the peer review process where other scientists look at your work and see what it looks like. But we've had some of that work that's starting to be published now. And then I think the last kind of part of what we do is work with human samples. So there's I mentioned earlier, a publication that just came out from multiple groups here at UNM we were able to be a part of, finding that people that have gotten sick with coronavirus or got infected with the coronavirus and then recovered, if they donate their plasma and clinicians at the hospital put it into patients, what we found is that you really have to test the plasma from people that have recovered before you put it into patients that currently have the virus in order to really have any sort of effect. Something that we've been able to do here is because of the facilities that UNM has, we've been able to work with not only investigators at UNM, at the Health Sciences Center, also on main campus, but also local companies here in New Mexico that we've been able to test their drugs. We've been able to test their inactivation procedures. We've collaborated with Sandia National Labs. We've been able to do a lot of local New Mexico collaborations that just strengthens the scientific and medical community that we have here. And I think really in New Mexico there are a lot of really good places to donate. I know people have donated with Dr. Harkins' study, without which I mean it would have been very difficult to do this work. And so I really really do appreciate people donating to help local New Mexico institutions, researchers, clinicians, the whole gamut of folks that are really doing what they can to pitch in this really unprecedented pandemic.